Hey future nurses, welcome back to Pathways NCLEX Review. If you're studying for the NCLEX and struggling to remember key medications, this video is for you. Today, we're going over the top 10 pharmacology quick facts every RN and LVN candidate should know. And make sure you stay to the end, because I've got one bonus tip that just might show up on your exam. Let's get into it. First up is Digoxin, a cardiac glycoside that increases the heart's contractility. Think of it as giving your heart more squeeze power. But here's what you need to watch for. Digoxin toxicity. The classic signs: blurred vision, nausea, and seeing halos around lights. It sounds almost mystical, but it's serious business. And here's a key connection. Always monitor potassium levels. Low potassium makes digoxin toxicity more likely, so hypokalemia and digoxin are a dangerous combination. Next, we have Furosemide, also known as Lasix. This is your loop diuretic. It works in the loop of Henle to pull out massive amounts of fluid. Two major risks to remember. First, hypokalemia. When you're pulling out all that fluid, you're also pulling out potassium. Second, ototoxicity. This drug can damage hearing, especially with high doses or rapid IV push. Speaking of IV push, always give it slowly. The rule is no faster than 10 milligrams per minute to protect those ears. Warfarin, or Coumadin, is your vitamin K antagonist. It blocks the vitamin K-dependent clotting factors. The key monitoring parameter? INR. International Normalized Ratio. You want it therapeutic, not too high, not too low. And here's the dietary teaching everyone gets wrong. It's not that patients can't eat leafy greens. They need to be consistent with their intake. Spinach salad every day? Fine. Spinach salad once a month? That's when you get into trouble with Indian rupee fluctuations. Insulin, you absolutely must know peak times. Regular insulin peaks in 2 to 4 hours. NPH peaks in 4 to 12 hours. Why does this matter? Because that's when hypoglycemia is most likely to occur. And hypoglycemia is insulin's biggest risk. Signs include shakiness, sweating, confusion, and potentially loss of consciousness. Don't forget injection site rotation. This prevents lipodystrophy and ensures consistent absorption. Lithium has one of the narrowest therapeutic ranges of any medication. We're talking about a tiny window between effective and toxic. The key to lithium safety? Hydration and sodium intake. When patients get dehydrated or their sodium drops, lithium levels shoot up. Toxicity signs to watch for: tremors, GI upset, and confusion. In severe cases, you can see seizures and coma. Beta blockers, you'll recognize them by the -olol ending. Metoprolol, propranolol, atenolol, they lower both blood pressure and heart rate by blocking beta receptors. Here's your safety rule. Hold the medication if the heart rate drops below 60. Important teaching point. Beta blockers can mask the symptoms of hypoglycemia. So diabetic patients might not feel their usual shakiness or rapid heartbeat when their blood sugar drops. ACE inhibitors end in -pril-. Lisinopril, enalapril, captopril. 3 major side effects to know. First, a dry, persistent cough. This happens in about 10% of patients. Second, hyperkalemia. They can bump up potassium levels. Third, angioedema. Swelling of the face, lips, and potentially the airway. Because of the hyperkalemia risk, teach patients to avoid loading up on potassium-rich foods like bananas and orange juice. Heparin, your anticoagulant for immediate effect. Monitor a PTT, activated partial thromboplastin time. The antidote is protamine sulfate. Remember that for your NCLEX questions. Watch out for height. Heparin-induced thrombocytopenia. It's when the body creates antibodies against heparin, causing dangerous clots. Ironic for an anticoagulant, right? Vancomycin, your antibiotic of last resort for serious gram-positive infections. Monitor trough levels to ensure effectiveness without toxicity. Always infuse slowly, at least 60 minutes for a gram, to avoid red man syndrome, which causes flushing and hypotension. 2 major toxicities: ototoxicity, affecting hearing, and nephrotoxicity, affecting the kidneys. Finally, Metformin, the first-line oral medication for type 2 diabetes. Key safety point: hold it before contrast imaging studies. The contrast can affect kidney function, and metformin in compromised kidneys can lead to lactic acidosis, a potentially fatal condition. Signs of lactic acidosis include muscle pain, difficulty breathing, and severe fatigue. Here's your bonus drug, epinephrine. This is your go-to for anaphylaxis and cardiac arrest. It's a powerful vasoconstrictor and bronchodilator. After administration, monitor heart rate and blood pressure closely. Epinephrine can cause significant cardiovascular effects. Patient teaching: always carry your EpiPen if you have severe allergies, and don't hesitate to use it. You can always give another dose, but you can't undo anaphylactic shock. There you have it. 10+1 must-know pharmacology facts for your NCLEX success. These aren't just facts to memorize. Understand the mechanisms, know the side effects, and always remember the key lab values to monitor. Remember, success isn't about memorizing everything. It's about mastering what matters most. If this video helped you feel more confident about pharmacology, don't forget to like this video, drop a comment about which drug fact surprised you most, and subscribe to Pathways NCLEX Review for more content like this. And if you're serious about passing your NCLEX on the first try, reach out to us today. Your RN or LVN license is closer than you think, and we're here to help you get there. Thanks for watching, and I'll see you in the next video.